From birth onward, all life is by a continuous process of cellular growth and replacement. The phases of development, maturity, reproduction, and senescence fulfill the biological cycle of all animals alike. But the changes involved in the menopause are characteristic only of womankind. The menopause may be defined simply as the cessation of menses, a process which generally occurs near the end of the 5th decade of life. All women approaching this period of life face readjustments in physical activity and mental outlook. The majority take this natural stage of development in their stride and pass through it satisfactorily with sensible management of their daily life. However, the physical and psychological changes may bring in their train symptoms so disturbing that medical help must be sought. The purpose of this film is to help the physician realize the significance of these symptoms, understand how to evaluate them, and give proper treatment to his patients. As the ovaries become senile, ovulation may fail to occur. There is a progressive decrease in estrogen production. The cycles become irregular, and menstruation is less frequent until bleeding periods cease altogether. The actual menopause is the time when amenorrhea thus becomes complete. It usually occurs between the ages of 45 and 50, but it may occur normally as early as 35 or as late as 52. Symptoms referable to the vasomotor system are very common. Hot flushes are typical of such disorders. The patient is aware of a sense of smothering and a feeling of warmth passing over the body. Dilatation of the superficial capillaries brings on the blushing of the face and neck. This may be followed by visible perspiration and later by chills. Many neurovascular changes occur, which often lead to a variety of subjective emotional disturbances affecting every woman to a greater or less degree. The emotional disturbances of the climacteric may take the form of deep depression or complete indifference to surroundings. There may be sexual maladjustments, complicated by the knowledge that the reproductive years are over. Anxiety and tension are probably responsible for insomnia and gastrointestinal upsets, loss of appetite, constipation, and sometimes diarrhea. A number of typical sensory motor phenomena are often associated with this period of stress. Nervousness, vague pains, headaches, and itching are a few of the troublesome symptoms. These patients will be helped or relieved by psychotherapy, together with sedatives and other supplementary medication when necessary. Ethinyl estradiol and other estrogens may be valuable in increasing the libido and general sense of well-being, and in modifying the effects of severe depression. The physician must always carefully weigh the type and intensity of his patient's symptoms in his mind and gauge his therapy accordingly. He must realize that her problems are real and in many cases acute. Frequently, explanation, reassurance, and mild sedation will carry these women over this transition phase of life. He should organize a well-planned schedule of therapy which may include diet, thyroid, estrogens, androgens, curettage, and occasionally radiation or surgery. The physician must keep in mind that the sooner the normal physiology of age is established without continued outside aid, the better will be the patient's total adjustment to the important remaining years of her life.